Hello, curious slimes. Welcome back, and as the title suggests, we'll be looking into hydronephrosis and also why I'm curious in science, as this relates to a lot of my past trauma. Hydronephrosis is a condition where, some way or another, urine comes back up the urinary system into the kidney, which can cause swelling. There are two main types of hydronephrosis based on when you were diagnosed. You could either be diagnosed prenatally or antenatally, meaning that you were diagnosed prior to your birth, or you could be diagnosed postnatally, meaning that you were diagnosed after your birth. Antenatal hydronephrosis can be caused with conditions that have relation to the pregnancy hormones having a relaxing effect on the ureters, or possibly where you have urine backflowing through your urinary systems because the valves in your ureter between the kidney and the bladder don't function properly. Now, antenatal hydronephrosis, though it is diagnosed in 1 in 100 cases, it often clears up after birth or during pregnancy. Postnatal hydronephrosis, or hydronephrosis in kids and adults, can develop from a number of things, such as kidney stones, ureter obstructions, but it could be caused by tumors, cancers, and even blood clots causing muscle damage, nerve damage, and muscle damage. Urinary retention, which is where you can't empty the urine you have, urine backflow to the valves, and also if you're a female signed at birth, pregnancies can cause this condition. Also having your womb slip out of place, or the wall between your bladder and vagina kind of coinciding together, making it harder for urine to flow. These all can be conditions that cause hydronephrosis, and there's a lot more on this list. With that said, hydronephrosis is still pretty uncommon, though not terribly too uncommon. However, hydronephrosis is usually very mild and will just go away with time. But if you have moderate or worse hydronephrosis, treatments could be needed. Prior to treatment, a doctor will need to inspect you to figure out what the problem is if you have signs and symptoms of hydronephrosis. Tests that could work to find hydronephrosis could be things like blood work, urinary tests, and ultrasounds. In antenatal hydronephrosis specifically, it is found in ultrasounds. Symptoms of hydronephrosis could be sudden or intense pains in your sides of the abdomen or the back of the abdomen, nausea or vomiting, painful urination, blood in your urine, urinary tract infection or UTI, peeing more or less than normal, and then not being able to completely empty your bladder. You may also get symptoms of a UTI, such as cloudy urine, painful or burning sensations when you urinate, and then feeling chills or feeling tired often. And then also you may get fevers. In rare cases, hydronephrosis may need to be treated as it gets more moderate or severe. Now, this could usually doesn't cause loss of kidney function, but it can do that. And so treatments to avoid this could be getting rid of any blockage, getting surgery for it, or fetal intervention. Now, hydronephrosis is also linked to genetics, especially when you have things like deformities in the ureter causing blockages, or predisposition to certain tumors or things like that. If you want to read more on hydronephrosis, I put some links in the description to start your research. These are sources I use to make this video, and also any extra readings I'm found on the way. Now, this part may get a little touchy for some, but for me, this is my experience with hydronephrosis. I was diagnosed with antenatal bilateral hydronephrosis, which means in both of my kidneys I had hydronephrosis. Now, like I said, typically it clears up, so when I was born, my right kidney had cleared up from hydronephrosis. However, my left kidney was still causing problems. So throughout the first 2 years of my life, I was continuously monitored with ultrasounds, blood tests, and urinary tests. I got pretty used to being in the hospital in and out, especially since I also had asthma. I still do. and this causes a lot of problems. But for me, in early life, I was mainly in the hospital for getting testing. Now, I also went in for testing in my third year of life, but it was this year that they realized intervention was needed, as I had really bad swelling and severe pain. My kidney could have failed if I didn't get treatment. So I had surgery for it. They put in a splint into my kidney, or my ureter specifically, and it cleared up since then. I had one UTI after that due to scarring that happened, and the urine building on that scarring, which led to more problems. And ultimately, I was pretty traumatized by this scenario, as I got very unsettling images in my brain almost constantly. And a strange effect is, if I smell bubblegum flavored scenting, I get tired, because that was the scent that was used for my mask, that they used anesthetics for. I was put on gas anesthetics, and I was only out for a little bit. It's completely fine now, but this really built my drive to want to learn about medicine, and this is why I want to share information, because I love sharing with people the information I found. I may not be the best speaker at times, but hopefully that gets better. I have one message for everyone. If anyone has a family member with hydronephrosis and you may be worried, please try not to be. If it is a moderate or severe condition, then I wish them the best of luck. But typically this does clear up over time, so hopefully that happens. And like I said, if you're curious to learn, I have links in the description so you can read more. Now, thank you everyone for watching this video. Have a wonderful day.